Pulmonary hypertension. Introduction. Blood pressure is the force of blood as it presses against the walls of the arteries. Select true or false. Correct. High blood pressure is also called hypertension. Pulmonary hypertension is a kind of high blood pressure that affects the arteries in the lungs. Many people with pulmonary hypertension do not have any symptoms. Select true or false. Correct. Many people with pulmonary hypertension do not have any symptoms, especially at first. Symptoms may get worse as the disease progresses. Which of the following can cause pulmonary hypertension? Choose one of the following options. 1. Cirrhosis. 2. Blood clot in the lung. 3. Drug abuse. 4. All of the above. Correct. Pulmonary hypertension can cause heart failure. Select true or false. Correct. Pulmonary hypertension may lead to failure in the right side of the heart. It can also cause blood clots, bleeding in the lungs, and arrhythmias. Pulmonary hypertension can be treated and controlled. Select true or false. Correct. Pulmonary hypertension can be treated and controlled. Your healthcare provider may recommend treating any underlying cause, medications, and lifestyle changes. Thank you for using Explain.